Okay. Good afternoon. My name's Dwayne. What's your name?
Allison.
Hi, Allison. What brings you in here this afternoon?
I just had shortness of breath and really tired and coughing.
Mm-hmm. You come in through the ED, right? Okay. Let me get washed up here and we'll kind of see what's going on with you. How long have you been having these problems?
For about 3 days.
Okay. Have you been around anybody that was sick, or?
Not that I know
Not
of.
that you know of, nobody that had the flu or RSV or COVID or anything like that?
No, it's all going around, but
Yeah, there's a lot of stuff going around right now that's all respiratory. So I've got a mask on as well, so I do everything with a mask. So. Well, I saw down that you had a little bit of a fever when you come in as well. Is your body aching or anything like that?
a little. Yeah, my fever was quite high.
Yeah, I know it was 102, and they brought it down, gave you some Tylenol down there. But still not feeling very good up here, right? Okay. Well, I'll tell you what, I'm gonna be your nurse for the day, so we'll just kind of go ahead and start out with a quick exam, if that's okay. That'd be all right? I'm gonna raise your bed up just a little bit. So, oh, wrong one, sorry about that. Are you hurting anywhere else, just having the trouble breathing? Are you having pain in your chest or anything? No, just a little bit of a cough as well? No tummy aches or anything like that? Okay, have you ever had this problem before?
No, not like this.
No? Okay. Well, I'm just gonna do a real quick assessment, okay? So I'm gonna check your pupils first, all right? Just kind of make sure everything's looking good. So if you just look straight ahead for me. Just kind of see what those are doing. Very good. Very good. And can I just look up your nose here real good? And can you, real big off for me?
Ah.
Okay, get good color and everything. So that all looks pretty good. And I would, is it okay if I touch you? Okay, I'm just gonna take and feel your lymph nodes. Okay, check those and see how those are. Not feeling any tenderness. Does that hurt when I touch any of those? No, okay, I don't feel any enlargement in those either. I'm gonna listen to your heart and your lungs and all of that, okay? Okay, now can you take a deep breath? Another one. Okay, I'm gonna go just down here a little bit. Another deep breath. Another. And if I help you, can we sit up just a little bit? I want to listen to your lungs on the back side, okay? Deep breath. And one more, two more deep breaths, one on each side here. Okay, so you can go ahead and lay back down. So the other thing I was looking at when you were taking deep breaths, I was just checking to make sure that your body's all symmetrical, that one side's not working harder than the other, okay? So everything sounded clear, so it's gonna be interesting to see what you've got going on, okay? Can I just take and get you to squeeze my hands for me? Just check your strength here and check your, make sure your circulation's all good. Are you having any tingling or numbness in your hands? Can you take and push my hands? All right. I'm gonna take a look at your IV site here, make sure you don't have anything going on. Did you just got that down in the ED, or did they start that up here earlier?
They did it
In the ED, okay. Having any pain or tenderness in that?
It's just, I don't like them there.
Right, they're annoying, I understand that. Okay, just gonna pinch your skin a little bit here. All right, looks like you're hydrated pretty good. Can you wiggle your toes for me? You feel those? Any tingling or numbness in your toes? Okay. Can I look at your leg here real quick? All right. Make sure I don't see any swelling. There's no edema. Check your pulses here. what about, can you kind of pull your feet back towards me? There you go. And kind of same thing, kind of push. Very good. Are you having any pain in your knees or anything like that? Any of your joints hurting? Nothing like that. What about your diet? Have you been eating normal the last few days, or
I'm just not hungry.
how long have you not been hungry?
It started, 3 days ago, but then it's gotten worse.
Mm-hmm.
So I've kind of been eating less.
Do you think it was something you ate, or?
No, I haven't had like diarrhea or
Okay,
anything.
okay. What about urinating? Have you been urinating okay? Any pain when you urinate?
It's dark brown.
It's dark brown. Does it have any kind of odor to it?
Haven't,
More abnormal than usual, or?
probably stronger.
Okay. What about bellyache? Have you been having any belly pain? Is it okay if I listen and touch your belly?
Mhm.
Okay. So, just kind of start up right up here. Okay, was there any pain when I was pressing on any of the quadrants? Okay. All right, well, doesn't appear to be anything going on there in the belly, so. Well, I'll tell you what, we'll just kind of, let's see. Are you having any shortness of breath right now? You still are? Okay. So I'll take a look. Your O2 stat, it's 91, but we typically like to have you up around 92 or so. I'll take a look at your order since I just come on and make sure that we've got an order for you. If so, we'll maybe get you going on a little bit of oxygen, see if that helps out a little bit. How does your blood pressure normally run?
I guess average. I haven't had a problem with it.
What is it normally for you?
About 110 over like 70.
Okay, so that's not too far off. It's a little low there. Your respirations, that's a little higher than what they normally like to be, right? We usually like those 12 to 20. Your heart rate's still up there as well. So, of course, with the temperature, there's, maybe some infection somewhere. So, heart rate may be up a little bit. But I'll kind of go back and take a look and see what you have order-wise. See if we can't get some oxygen, help that breathing out a little bit, and get that heart or that respiratory rate slowed down a little bit, okay? Is there anything else I can get for you right at the moment?
No.
No? Okay, well, here's your call button, and if you need anything, just give me a shout, okay?